Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over something known as adverse childhood experiences. Now, you may have come across this theory a while back in some context when you were going over and learning about different aspects. This was a concept that was new to me when I first encountered it. But personally, I've been working with multiple collaborators on understanding the connection between ACs, adverse childhood experiences, and gun violence. So there's a lot of there are components within childhood, negative components that have been experienced, and how that affects the individual 30, 40, 50 years ago, years later, is especially important to understand. So let's go ahead and get started. Let's start from the left. Some of these. So this is numbered one, two, three, and then four, five. So let's go in order of how this appears. So some of the three categories of ACs are are comprised of 10 original. So there's 10 categories and three umbrella of categories as well. So abuse, neglect, and household dysfunction. Abuse, this assesses for physical abuse, emotional abuse, and sexual abuse. Neglect, physical neglect, emotional neglect. And then household dysfunction. Was there intimate partner violence? Was there substance use in household? Was there mental illness in household? Was there parental separation or divorce? Or finally, is there incarcerated household members? So these are the 10, and these are the 10 that we asked in our questionnaire that we collected from about 314 individuals. So the idea is the more ACs, the greater the risk of negative outcomes. So how does ACs impact health and well-being? So if you experience this in childhood, 0 to 12 ages, then that carries over to adolescence, young adulthood, and then older adulthood. ACs can, in fact, change the brain development, stress response systems, and immune function. And this can lead to very detrimental long-term long-term effects. What are the possible effects? Some of them, I'm not going to go over all 15 of them, but there's challenges in learning, behavior problems, difficulties with emotions, poor academic performance, risky behaviors, mental health challenges, difficulties in relationships, poor job stability, mental health challenges, and the list goes on and on. Substance use is a big one, and we saw evidence of that within our study. And this is, by the way, grant-funded study. And then finally, increased risk of disease, cognitive decline, and reduced quality of life. So what are the risks and outcomes? Some of the outcomes include health problems, even things like heart disease. So any sort of psychological trauma that a person experienced during childhood, imagine, can lead to even heart disease, physical diseases like heart disease, diabetes, cancer, stroke, chronic lung conditions, obesity, etc. What about mental health conditions? Well, this is more something that is more self-evident because there's mental health conditions in childhood or exposed to mental health detrimental effects during childhood. So anything from depression to bipolar disorder, suicidal behavior, that's pretty common with people that have been exposed to ACEs. And then health risk behaviors, smoking, excessive alcohol use, drug use, risky sexual behavior, poor educational attainment, unemployment, financial instability, involvement in violence or criminal justice system. ACEs do not determine destiny. Healing with support can change the trajectory, though. So number 4, we're almost done here. The science, what's the toxic stress explains the impact. So when a child experiences ACEs, it can activate a prolonged stress response. And this can be allostatic load can be really high. And I'm not going to explain allostatic load here, but worth looking up. So this toxic stress from ACEs can wear down developing systems in the body. Over time, this increases risk for disease, physical diseases, and other problems. Um, so not all stress is bad, by the way. Positive, supportive relationships can protect children from the negative effects of ACEs. So finally, what helps? What are the protective factors? Self-stable, nurturing relationships, supportive families and communities, social and emotional skills, quality education, and access to healthcare and support. Um, so the idea is prevent ACs, build resilience, heal trauma, and thriving as possible. So that sums up everything. I hope this has made some sense. Thank you for listening.